Hi, I'm Dr. Jess Goodman. I'm one of the developers of iHeart, a unique device that reads your pulse signal to give you an understanding of your internal health by looking at your aortic stiffness, which is a measure of your stiffness inside along the spinal axis. If you use iHeart and you exercise, you have a good diet, and you manage your stress, you will feel better and live longer. I'm here this evening to answer a few questions to give people a better understanding about what iHeart is and how best to use it. The first question is from Arnie Larson. Why do I get varying results when using my iHeart? This is a great question because it shows that iHeart is looking inside in an unfiltered way. iHeart is looking at a signal called aortic pulse wave velocity. We look at the pulse signal from the finger. We find a wave that is related to aortic pulse wave velocity. That is the way aortic stiffness is measured. Aortic pulse wave velocity is affected by two main factors: aortic stiffness and blood pressure. It's really important when you test with iHeart to make sure that your blood pressure is stable. The most important thing is to sit in a relaxed way for about 2 minutes to let blood pressure settle. It's also important to avoid things like coffee that drive blood pressure and pulse rate up. It's important to not have a big meal before testing. If you exercise just before testing, you will see a drop in your internal age and your aortic pulse wave velocity reading as a temporary effect of exercise. So if you want to have really consistent effects, you should rest for a few minutes before testing, avoid coffee and exercise and a big meal, and try to do it in a consistent way so that about the same time every day you do your reading. People have found that testing in the morning, before getting too active, before having breakfast, before having coffee, you get the most consistent readings. If you just get up, move around, you will notice that your iHeart readings race all over the place. This is normal because iHeart is not a weight scale. It's a transparent way to look inside and see what's happening with regards to aortic pulse wave velocity and aortic stiffness. There's no tricks here. There's no smoke and mirrors. We're showing you only what comes in an unfiltered way. Unfortunately, that lets you see the blood pressure effects as well. So if you're stressed, you will see that your internal age goes up because of the blood pressure effects. Aortic stiffness changes slowly over weeks or months. Blood pressure can change over minutes to hours, and from one day to the next, your blood pressure may be significantly different. So, test every day if you want to. Don't be upset if your readings are a little bit up or a little bit down. Look at the trend, and what you will see is that your internal age really does reflect what sort of lifestyle factors you are applying to your life. Are you exercising? Are you eating well, especially omega-3 fish oil type foods? And are you trying to manage your stress, trying to breathe away that stress and get to a place where you feel calm and relaxed? The next question is from Daniel Nioto. Daniel Nioto asks why the internal age result fluctuates wildly, 35 years to 65 years, with different sitting positions. What is the best sitting position? Daniel, that's a great question, and it to some extent is related to the first one. It's not quite the sitting position that's important, it's the relaxation as you sit down. If you sit in a way where you feel relaxed, where your back is not arched back or you're not bent forward, if you're kind of sitting over your sit bones and you feel grounded, then you're going to get very consistent readings. The problem is if you move around from one place to the other, especially if you get up. If you get up, your blood pressure is going to drop, and that's called the orthostatic effect. So you should be really careful. Sit down, nice comfy chair, beanbag, doesn't really matter. But give yourself a couple minutes to let blood pressure settle, and you should see some very nice and consistent results. I'm just taking a look here to pick up on other questions. How is internal age calculated? Internal age is a simple way for people to understand aortic stiffness. Aortic stiffness on its own is kind of hard to explain, especially if we use aortic pulse wave velocity readings. There's no intuitive way to grasp what 6 meters per second is compared to 12 meters per second unless you look at a graph and find the average for age and so forth. What internal age does is it looks at your internal stiffness, your aortic stiffness measured using pulse wave velocity, and compares that with other people your age, hundreds of other people. If your aortic stiffness, aortic pulse wave velocity is higher than average, you will see your internal age be above your chronological age. If you have an aortic stiffness that is better, your aorta is more mobile, and your aortic pulse wave velocity is lower, your internal age will be lower. So internal age is really just a way to assess aortic stiffness compared to the average for age. Another very common question is, why does aortic stiffness predict the risk of death from all causes? And this gets to the heart of the reason why I spent time developing iHeart and why I'm so excited to get other people using it to feel better and live longer. Aortic stiffness is really a measure of stiffness along the axis of the spine. The spinal column runs from the head down through the chest and abdomen right to the tailbone. The aorta is the body's largest blood vessel, and it runs from the heart through the chest, down through the abdomen, immediately in front of the spine. So by measuring aortic stiffness using aortic pulse wave velocity, we're really measuring stiffness of the spine. The spine is so important in allowing us to breathe effectively. With each breath, your rib cage should expand and contract. The diaphragm muscle here should drop and descend and then rise. As the diaphragm muscle drops, the kidneys, the liver, the spleen, the internal organs are massaged. They are soft and spongy. And as they are compressed by the diaphragm, fluid is expressed out, and as the diaphragm rises, fluid returns. So diaphragmatic movement, massage of the internal organs with every breath is a way to promote internal circulation of your internal organs. The other really important thing that happens with each breath is that spinal fluid that flows all the way down the spine, back up to the brain, around the brain, and through the brain is pumped. Hang on just a minute. 1 second, please. I need you not to talk. The spinal fluid is the thing that gives your brain the food it needs and is maintained in a state of purity that allows the brain to function and not develop deposits that eventually will lead to cognitive decline and dementia. With each breath, if you have good spinal mobility, good rib cage mobility, good diaphragmatic movement, and overall, I term this core mobility. If you have good core mobility, you will have great cerebrospinal fluid circulation. You will keep that fluid pure, you will give your brain a beautiful environment in which to function. You will be able to think better, have better memory, and be much, much less likely to develop degenerative brain conditions such as Alzheimer's disease. That's about it for today. I'm looking forward to many more sessions. Please send your questions. Sarah, who's the CEO for Vital Signs, and myself really do want to give you all the information you need to use iHeart as effectively as possible. So good health. See you soon. Bye-bye.